Buongiorno a tutti.
Hello, everyone. We're here today to present and officially launch the worldwide campaign A Vaccine for All, an initiative that promotes access for all to vaccines against COVID-19, together with a symbolic action to bring care and treatment to populations of different cultures and religions. Welcome to the journalists who are participating in the press conference, and also to those following this broadcast through the official YouTube channel of the Focolare movement. We are live streaming with translations in English, Spanish, Portuguese, and French. My name is Lourdes Hercules from Guatemala, and today I have the pleasure of introducing those who are part of the campaign. They are made up of movements, health organizations, and research centers around the world who believe in the universal right to treatment and to vaccine internationalism. More than 40 organizations are engaged in this promotion. Today, there are representatives of some of these organizations here with us. The following will speak briefly. Alessandra Smerilli, the Undersecretary of the Dicastery for Promoting Integral Human Development in the Vatican. She coordinates the Economics Task Force of the Vatican COVID-19 Commission. Yassine Lafram, President of the Association of Islamic Communities of Italy. Mario Bruno, President of the Politics for Unity Movement. Vino Aram, President of the Shanti Ashram, Conleth Burns, and Clara Piedade, Youth for a United World of the Focolare Movement. Gianfranco Cattai, Coordinator of the Rete in Opera, a network of associations in Italy. Stefano Comazzi, President of the Action for a United World NGO. And Edson Gallego, a health worker on the Pope Francis Ship Hospital in Brazil. After their talks, there'll be time for journalists to ask questions. Live, of course, on the Zoom by raising your hand. And it will also be possible to respond to questions that the general public can ask on the YouTube chat. Now I'm going to hand over to Conleth, Clara, and Mario, who will introduce the project.
Thank you, Lourdes. Almost 1 year ago, a group of young people from all over the world came together to launch the Dare to Care campaign. Our proposal was simple. We wanted politicians and active citizens to put care first. Faced with the immense challenges of this pandemic and so many of our interconnected crises today, we needed then and continue to need now a new perspective, a new way of looking at the immense challenges we are facing. This campaign is not just a slogan. It's based on actions and initiatives from all over the world, whether it's campaigning against deforestation in India, protesting for democracy in Myanmar, mentoring new leaders in Burundi, building roads in rural El Salvador, calling for better political dialogue in Spain, or working on political polarization in the USA. In all of those communities, people have tried to come together and be the change that they want to see in their community and in the world. We've signed up to do 3 things in this campaign: to learn, act, and share. Learn what the needs are in our local and global communities, act to respond to them, and share these experiences with others who want to join us. So in our recent campaign week, United World Week, at the start of this month, and here today, we have the natural next step of this campaign: a vaccine for all. I come from Northern Ireland. Almost 70% of adults here have received 1 dose of the vaccine. Soon I will get my first dose. A friend told me of his experience of getting vaccinated recently, of queuing up, getting the jab in the arm, waiting for 15 minutes, and going home grateful. To the scientists who made it, the logistic experts who organised it, and the nurses who administered it. It was a moment where he felt real togetherness, felt like he had done his part, felt like he was cared for by others, and was also caring for others in that vaccine action. This should not be the experience of a privileged few. It should be the right of every person, no matter where you come from in the world. And that is why this Dare to Care campaign is committing itself to work both at a political level and a community level to make this vaccine for all a reality. Mario and Clarinha will explain how we will do that.
Yes, we learned that taking care, the caring is the new name of politics. As a shared global problem, the COVID-19 virus can only be defeated through a shared global good, vaccination for all. During a pandemic that we all live, Medal discovered we are all equal. Medal discover brotherhood that makes us find a response for all, especially for the poorest countries that have no access to care, to treatment, and also to free vaccine. Vaccine internationalism is the answer, the political answer that governments and international organizations can and must give. There is also a popular response that we can make together. We who belong to various cultures, to many peoples, to various religions, united, we can give these as a response from many peoples and also from governments, as we'll hear from Clarinha. Tomorrow there is a World Summit on Health chaired by Italy as a part of the G20. They will also discuss whether the urgent solution will be to suspend patents or whether they will be able to reach agreements with the pharmaceutical companies for lower prices that are affordable even for the poorest countries. But especially we ask them the courage to find agreements with the pharmaceutical companies for a sense of solidarity, so that the poorest countries can buy also this vaccine, and that governments, inspired by this category of solidarity and not by new forms of colonialism, will fund vaccines, especially for the countries that are most in need for them. So a sort of suspended vaccine, as Pope Francis is doing, to the benefit of those invisible, and a vaccine for all, especially for the poor. What seems indispensable is to transfer know-how and the supply chain to the world's less developed countries. So we have this need that we feel so strongly of taking care of everyone, and especially of the poorest. And now Clarinha will tell us that while we wait for the decisions and we stimulate the governments, there is a popular response that we can give together. Is that right, Clarinha? Thank you, Mario.
Thank you, Mario. Conleth mentioned that during this year, we young people for a united world, with a network of people spread all over the world, young people, adults, teenagers, and children, are engaged on a journey where we try to put care at the center of our lives as active citizens and as politicians. We learned that an active citizen is one who is committed and gets involved in all matters concerning the world in which he or she lives. Now we're in the middle of a global health crisis. We've seen the world grind to a halt, people lose their jobs, and thousands of human beings dying for lack of access to health care, which is a fundamental right for the life of each and every human being. We cannot be passive, neutral, or silent citizens in all this reality. And even in the face of a scenario in which we are faced with many questions, fears, and insecurities, we feel that we cannot lose hope. We want to act, to take action and do our small part to fight and resist the inequality of the distribution of the vaccine and in the prevention and treatment of COVID. Mario told us about the need for political action so that the vaccine can be available to everyone. But this political and institutional work, it is fundamental to solving the problem. Nonetheless, we cannot expect solutions to come only from the governments. We want to roll up our sleeves and do our part as active citizens. For this reason, together with people from many different parts of the world, people of different religions and also age groups, we decided to launch this worldwide initiative to guarantee the common good to those who today have no voice. To start with, we want to concentrate our efforts in a part of the Brazilian Amazon region in the state of Pará. Soon we'll hear from Edson, who'll tell us a little about what's going on there, in which we're already present and at work in an atmosphere of trust and cooperation. With this campaign, we propose an online donation for the sake of the inhabitants of this region who live on the banks of the river dwellers, where the population doesn't have access to healthcare because often they are unable to reach the treatment centers. All the money raised will go towards the purchase of vaccines, kits for hygiene and prevention of the virus, as well as protective materials and assistance in treatment during and after the disease. As a Brazilian, I can say that the reality of the pandemic for indigenous and river dwellers is much worse than the official records show us. They are mostly people forgotten by society. They live far from urban centers and places where they can get treatment, and who today experience not only a health crisis, but also a social, economic, and environmental one. We are dedicating ourselves to these people because we believe that vaccines and care for the Amazon are necessary at this time, and at the same time, they also allow us to call attention to the importance of this reality that must be protected by all of us. Now we are moving to the Amazon River itself, where the Pope Francis Hospital ship is based and which, since September 2019, is reaching different regions, assisting families in need of care who live on the edge of the Amazon River, where the river dweller population doesn't have access to social and health care. This project will be presented by Edson Gallego.
Ciao a tutti.
Hello everyone, I am Edson, I'm a nurse, and I bring you a special greeting from the heart of Amazonia. We are in the port city of Óbidos, which is located on the bank, the narrow bank of the river. I live in a poor neighborhood with many painful situations. Since the city is between the forest and the river, it finds itself isolated and closed in its social problems. And here challenges are not lacking, and there will always be. With the contribution of many volunteers, young people and adults, professionals from various fields, it was possible for some years to carry out the Amazonia Project, an initiative created to take care of serious social, economic, and health situations. The situation here was already precarious and worsened a lot with the arrival of the COVID-19 pandemic, an emergency that happened suddenly. Because despite being aware of the seriousness of this disease, many people took it lightly. The minimum forms of prevention have not been carried out. But the footage traveled the world showing the force with which the pandemic hit the Amazon region, leaving behind many, many victims. In the region, there are small hospitals, but very few doctors and very few health personnel. They really manage to work miracles with their work. But these hospitals almost always treat people living in cities. All the rest of the population living in communities along the river find themselves without a minimum of health care. Hence, the Pope Francis Hospital ship was built, so as to reach those farthest away and in need of medical and health assistance. It has already reached a total of 700,000 inhabitants along the river, a real miracle thanks to the commitment of many volunteers and financial aid, which, however, is not enough. The commitment was greater in this period of pandemic emergency. We have therefore reorganized specifically to combat the pandemic, together with health professionals and specific medical assistance. The hospital in the city does not have an intensive care unit. There are only 16 beds, few ventilators. At a certain moment, there were no more oxygen cylinders and medicines. The hospitals were soon full, with queues impossible to manage. The need at the moment for vaccines is for vaccines. Distribution is proceeding very slowly, but a large part of the population has not yet been vaccinated. The state mainly helps those who live in urban centers, and thus those who live on the margins, like the inhabitants on the banks of the river, risk being invisible. In this month, the situation has worsened because we are in the period of heavy rains. The level of the river has risen a lot, flooding the communities along the river, preventing fishing and navigating to the city to acquire food, medicines, and others. We continue here, like small yeast grains in the great mass, trying to bring hope and the joy of living. We believe that only in this worldwide network can we truly aim at a universal sense of the family, and together concretely embrace this piece of humanity, which is suffering and is excluded. Together with you, young people of the world, we want to take care of it, of all of them. Thanks for what we will do together.
Porto a tutti un saluto qua dell'Amazzone del Brasile.
So I bring you a greeting from Amazonia, Brazil. Especially, I want to thank many for this project we are carrying out. This is a project that is a fruit of the donations of many medical doctors, nurses, and volunteers from Brazil and other parts of the world who came here in Brazil in the last 2 years, and many healthcare operators who contribute to this project of reaching the last of this human chain they need. But three persons, it is important to appoint Friar Francisco, the superior of the friars who founded this experience of the hospital ship, Pope Francis, together with the Monsignor Bernardo Rigansbalbo, who is the Bishop of Óbidos, and with the prophetic urge of Pope Francis, they sent out this project, which is possible with the collaboration of many people in the world, and many children with their savings. They contribute to help us in this mission. But we'll help during this meeting the opportunity to talk more about this. Thank you. Thank you, Edson. And we should remember that a chat through YouTube is open.
Thank you, Edson. The YouTube chat is open and you can ask questions there. So now I'll hand over to Sister Alessandra Smerilli.
Eccomi.
Here I am.
Grazie. Io volevo innanzitutto ringraziare.
First of all, I wanted to thank you for this initiative and for the way in which you are conducting it and launching it. Thank you, because right now, working in the Vatican COVID Commission set up by Pope Francis at the very start of the pandemic, Pope Francis immediately was worried about the social and economic consequences of the pandemic, and he asked us to prepare the future. not to wait, but to do something already so that the future should be different from the world before the pandemic. But he said, do this, please, as he said, in a practical way, be practical. And I see that this project, which is based on action above all, but at the same time seeks to be a voice that wants to make everyone understand the need we have to change our outlook on vaccination. The project is an icon of what Pope Francis is asking the COVID Commission to do, and I think it's a project that will be very much in his own heart. It's also a project, and this is what I feel we must understand better, that isn't a charitable work. People who are worse off than us now in a pandemic that's affected us all indiscriminately, but not all equally. There are people, many people suffering more than others. At this time, we must understand that those who are in greater difficulty shouldn't be given crumbs and leftovers. It's not a charitable work. It's about justice, the debt of justice we owe to these people. As Pope Francis reminded us, none of us can be saved alone. We only can be saved all together. We will not all be saved until everyone has been vaccinated. I'll read his words. Care, treatment for the virus has to be planned, going first to those most in need, the elderly, health workers, people who are weak, vulnerable, the poor and the forgotten. So your project is stating we want to plan something, we want to do something that goes in the right direction. We know you've mentioned all the subjects concerning the vaccine and the economic aspect of the production and distribution of the vaccine. So the question of patents, the suspension, at least temporarily, of patents, internationalism, and also cutting the prices, because we know that the pharmaceutical houses are making massive profits, and those who pay the consequences, the people who are paying the higher prices, are those with the lowest incomes. This is not right. So we must work on this line of lowering prices too, and patents. There's also a question of technologies, distribution. So while we are working on in the short-term period that the vaccination should reach adults, to prepare the future, we must be able to study vaccines that are not only made and manufactured in the West. Let me explain. The vaccines we have now need extreme temperatures. They need a cold storage accompaniment from start to finish, and this is extremely difficult for some peoples. So we should apply our energy, all the innovations possible, to produce vaccinations that can be easily transported and produced in all places all over the world. So I renew my thanks to you for this project. I thank you for your practical work. And then, as Pope Francis said, let's help one another to dream big. And it's not dreaming what it is impossible, it's dreaming a dream of those who, as soon as they wake up from their dream, set out to put it into practice. So there are many signs of hope. The request is that private interest should not be put before the health of every person in the world. As we said, because no one can be saved until we are all saved. So thank you again to all of you. Thank you, Alessandra Smeril. Now over to Yassine Lafram. Thank you. Good day, everybody. I'm honored to be with you. I thank the Focolare movement for promoting a campaign, organizing a campaign of this kind, and of involving us too. It makes us very hopeful in a better world, and we would like to be able to make our contribution to a campaign. It's true that it's confined at this moment to a precise location in the world, but it calls for our attention, it draws our attention to what's going on in the whole world. And certainly the developing countries, the countries of the third world, are suffering more. The dire consequences of the pandemic. I'm very sorry to witness this growth in inequality, which is growing ever more because a vaccinated person is a privileged person. A vaccinated person becomes, or a non-vaccinated person is like a leper to keep at a distance, because those who are not vaccinated at a certain point will be almost considered as infected people with regard to the privileged peoples around them who've received their vaccine. So this in itself makes us realize that we risk creating greater injustice in parts of the world where it's already burdened with poverty, drought, hunger, injustice, and inequality, and undermine the possibility of living a dignified life. We share responsibility for what is happening in the world today and also what could happen in future. It's been said clearly earlier that we are profoundly linked, and we're in danger that once we've vaccinated entire populations, we will start to reject and look suspiciously and distrustingly at countries that haven't managed to vaccinate 1% of their population, and not even their healthcare workers. So we're really concerned about this, and we have great hope in this campaign, trusting that other campaigns for vaccination for other disadvantaged populations will also take place. Considering the immediacy of the moment and what is happening today in the Palestinian territories, we must remember the Gaza Strip, which is a tiny area with a high density population, has been the only laboratory for making for COVID available to the Palestinians was bombed, and only 3% of Palestinians have been vaccinated in comparison with 60% of the Israeli population. So it helps us reflect on the situation of the pandemic, which continues to be very aggravated in parts of the world. In the Gaza Strip, every 24 hours, there are 2,000 more infections. 43% of the population are infected. Let's not forget that while some countries are vaccinating children and adolescents, in many other countries, not even their president, for the sake of understanding, or the dictator, has been vaccinated, and new variations are reaping victims. So we hope that we recognize that the whole world can stand on its feet again if we recognize our interconnectedness, our shared responsibility. Thank you for the work you are doing. We thank you very much, President of the Muslim Associations of Italy. And now I go over to Gianfranco Cataya, coordinator of Retinopera.
So, good afternoon. It is an honor to be with you today. I bring you the greeting of Radio Opera, Networks in Work, that was born in 2002, that gathers 22 Catholic associations on a national level with 4 million adherents. The Focolare Movement is part of this, and it is, in fact, a milestone in our association. We are living a very important opportunity, an extraordinary occasion, because concerning this theme, there are two kinds of approach possible. One is the right to vaccine. So one kind of approach, one based on solidarity and one based on safety. The one based on safety, nobody's safe until we are all safe. This is very secular, but it is the effect, the very effect of globalization. We are understanding this now. Two, without solidarity, there is no future. But for how long we know this, the effect of disequalities from north to south and also within the same north shows that if there is no solidarity, disequalities and forms of poverty grow more and more. So this is an important opportunity, so that with a systemic work, based on an approach based on subsidiarity, subsidiarity is present in the Italian constitution that puts together the role of politics and the role of economics, the role of civil society. So we have to face actions that, as has already been said, are actions of justice. So to cooperate in order to give responses of justice to all in the world. So I think, and this begins today, this discourse begins today with the campaign of vaccines, and based on this specific experience of Amazon region. So this experience concerning vaccines and concerning healthcare should open a new future. And I refer specifically to the production of essential pharmaceuticals, essential drugs in the impoverished countries. For how long we have been discussing about the possibility that essential drugs can be produced locally, and also using the local know-how about medicine. I think this is important, and I have a direct experience on the fact that some attempts have been made, but we have seen the block of the pharmaceutical companies. So we are not out of the world, we are not naive. But the common word in the world today must pass through experiences at the top, in the first line, and the one we are launching together, and we are honored to do this, is a very important experience. Thank you very much.
Grazie a lei.
Thank you very much. Now we hand over to... So we thank you, Gianfranco, coordinator of Rete in Opera. We go over now to Stefano Comazzi, President of Action for a United World.
So, good afternoon to everyone. As has already been said several times before, this campaign includes a practical project in solidarity with one of the many populations particularly in need and excluded from access to the necessary treatments and prevention programs in the COVID-19 pandemic. We would have wanted to reach everyone, but we saw that we can start with the 7 municipalities in the lower Amazon region, that is Alenquer, Curva, Faro, Óbidos, Oriximiná, Terra Santa, Holy Land, and Juruti, in the Brazilian state of Pará. We are talking about a population of about 2,600 inhabitants, 260,000 inhabitants, many of whom live along the banks of the Amazon River. They live by fishing, subsistence, agriculture, and mineral extraction. That is why they're called ribeirinhos, that is, river dwellers, people living on the river banks. This action began in support of the work carried out by the Diocese of Óbidos and the House of St. Francis Association to help these populations, and that since 2019 has been operating with 2 well-equipped hospital boats or ships. Each mission lasts about 10 to 15 days, including round trips to the Óbidos base, where the ship remains stationary for 5 to 7 days for the resupply of the staff and break before departing for a new mission according to an annual calendar. These are populations that live isolated along the Great River and where even the public health service struggles to reach people effectively and consistently, while the pandemic has found no obstacles and has quickly spread and made many, many victims. As has already been said, regarding the health policy of the Brazilian federal government in response to the pandemic, at the moment we are not yet able to predict if and how vaccines will be brought and distributed to this population. But together with the Association of Franciscans, we thought about a program that, in addition to vaccines, strengthens medical care, focuses on awareness and prevention, and offers basic assistance to the most vulnerable families of these 7 municipalities. So as soon as conditions permit, the vaccination program will take place, obviously in collaboration with the health authorities of the municipalities concerned, and according to the priorities of the National Immunization Program of Brazil. At the moment, the cost of the vaccine is between 6 and 7 euros, but this is a figure that may change as the situation evolves. The medical treatment will take place in the context of the existing health program of the hospital ships with triage, diagnostics, and specialized care when necessary. In view of prevention and preventive treatment, in collaboration with local leaders, there will be orientation and awareness programs on hygiene, social distancing, and delivery of protective and hygiene packages containing masks, alcohol-based gel, disinfectant, soap, and other goods for personal care and hygiene. It will also provide protective material for people who are dedicated to this work and visits to the communities. The estimated cost of the packs is between 15 and 16 euro. Finally, the aid program for the most vulnerable families provides for the distribution of packs containing rice, vegetable oil, beans, sugar, pasta, milk powder, flour, salt, coffee, and other foods, including those for children. If possible, personal hygiene and disinfection items will be distributed. The average cost of each unit is 17 euro. Before concluding, I'd like to emphasize a very important point: reciprocity. Reciprocity for us of AMU, Association for a United World, we attach great importance to it, so that no one feels a passive beneficiary. Instead, bonds of fraternity are to be created between the communities of those who donate and those who receive them. This vision is also shared by the Óbidos in the Association of Franciscans, so much so that in their stays along the river, the communities visited usually contribute with what they have: poultry, fruit, and vegetables, other goods. And many make themselves available with voluntary services to support and contribute to these missions. So I invite you to support this campaign and this action. With around 20,000 euro, around 550 health and food packs can be distributed, or more than 3,000 doses of vaccine. Obviously, with higher figures, many more people and communities will be able to be helped. So waiting for the rest of the planet to be able to arrive in a fair and effective way to protect the many who are still excluded, I thank you and I wish the best to you.
Grazie a Stefano Comazzi.
Thank you to Stefano Comazzi. So we have a final but not a significant input from Vino Aram from the Shanti Ashram. We're very honored to have you with us, a country like India so much affected by the pandemic. Over to you.
Thank you very much. I join in this moment of calling for solidarity. If you look at the signs of the pandemic and the count of the pandemic, we know that the world has crossed a count of 160 million people, brothers and sisters who have a name, who have an address, and a family they belong to. In my own country, India, which is in the midst of the second spike, 26 million people have tested positive to the coronavirus. Yesterday in India, we contributed to a statistic that I think has pained us all. We have had the single day count. The number of deaths per day has been the highest so far since the pandemic began in January of 2020. What I want to say is the pandemic is not over. And what I also want to say, the pain, the suffering from this disease is not over. And therefore, brothers and sisters, all of you who are at this press meet, this is a collective struggle against a virus that is non-discriminatory. It affects everybody. It has affected 200 countries. But the effect of this virus is not equal. And that is why when I was invited by my Focolare brothers and sisters in India to join this press meet, I immediately said I will join. Because the second piece to this pandemic is what society does together. Science is telling us about the virus, the way it affects our body, the way it is spread around the world, and we know it can spread very fast. The second pandemic has shown us that it has acquired a lot of speed as it spreads from one place to the other, one person to the other. It is affecting society. As leader of a Gandhian organization, as a public health person, a medical doctor in training, I know what you see is the disease, but the circles of effect, it has affected the economic space for 2 years, almost 2 years now. 1.5 billion children around the world, including my own country. Children have not had a normal life. They have not been able to go to school. They've not been able to be with their friends. They've not been able to study. We also know there is an economic crisis, and Sister Alessandra spoke to us about being equally affected economically. But we also know it is a moment where there is a crisis of human values. And this is where the idea of vaccine for all is so important. There is an ethics of care that is taught in medical schools. Why should we care? And a number of people on this press meet spoke about justice, about this shared vision of being one family, but also the practical understanding in these 15 months that the virus will travel quickly. So just caring for oneself is not enough. Pope Francis inviting us to think of this idea of solidarity is so important. In fact, Mahatma Gandhi at the turn of the 20th century in India said, faith does not admit of telling alone. It is not enough if we speak of the values. We have to live in the values. And I'm so grateful to the Focolare movement, its different pillars, the young people through the United Week Project, World Week Project, AMU that is there, the Support at a Distance program, all its various programs have invited people to think about humanity. Stefano was telling us about the cost of a vaccine, cost of a PPE kit. If you hear those individual costs, it is possible. It is possible for the world to bring resources to care for one another. And that is why the final word that I want to say is that science tells us that the vaccine works along with the social vaccine. This project will work on the social vaccine, the masks, the physical distancing, the hand washing. But we also know for the first time in the world, scientists have worked together to find this vaccine so quickly. In fact, my country, India, has had the great honor of having 2 companies that is manufacturing, and more will do. But you know, today, just our markets, not just the way we work together. I heard about the globalization that is bringing us together. But today we have a moment to see that solidarity can contribute to safety. And this is what Mahatma Gandhi said, that the progress of everybody has to be counted in times of crisis, and the progress of everybody must be counted in times of prosperity. Sarva Udaya, the progress of all. So I'm very, very happy that this practical action program is starting. We have to start somewhere. I'm very happy that we're making the big call for vaccine for all. Rich and poor, global north and global south, the old and the young. I personally have been working with the government of India, and this is the call we are saying as well, vaccine for all, not just for Indians, not just for Italians, not just for Americans, vaccine for all, because the global family is interconnected and the global family needs to come together to dream of a future where we will be able to live our solidarity. So I'm with all of you in spirit, and I'm with you in any way from India, brothers and sisters. We will also contribute to this project. And I invite everybody who's listening to the press meet, the cost of one vaccine, the cost of 1,000 vaccines, one PPE kit, 1 million PPE kits, whatever you can, please join this project, because it is people's lives that we will protect, and it is our collective humanity and unity that we will place at the service of our people. Thank you very much. Thank you very much.
Grazie, ringraziamo di nuovo Avinu Aram.
Thank you to Avinu Aram.
Grazie anche a tutti I nostri ospiti.
Thanks to all our guests and some of the organizations who've been with us. We're going to end the presentation by showing you the website that has been established to promote the campaign. This is a brief video showing how the site has been constructed in different languages. You can find information about the different organizations sponsoring the campaign or behind the campaign. It explains everything that's happening. You can become a partner too. Those who want to become a partner in the campaign, different organizations and networks and associations who believe in this vaccine as a common good. It's also possible to give via the internet site, which you can find on the top right.
Indirizzo di questo sito? A vaccine for all.
So the address is avaccineforall.org.
Due azioni importanti che potete trovare in questo sito, come donare e come.
So 2 important things are how to give and how to become a partner.
Ripeto l'indirizzo, avaccineforall.org. E ora apriamo lo spazio per
Now we've got questions, time for questions. Please introduce yourselves. You need to put your hand up if you're on Zoom. If you're following the press conference on YouTube, you can do it via the chat.
Vediamo se abbiamo qualche domanda da parte dei giornalisti. Aurelio Mole.
Allora, avevo alcune domande. Sono Aurelio Molè.
My name is Aurelio Molè. I work for News City and the television program in his image. What Stefano was saying, Stefano Comazzi, when is the vaccination starting, and is it going to be extended to the other parts of the world, or is it only concerning the river dwellers? How do you want to put pressure on governments, practically speaking?
Stefano Comazzi risponde.
Sì, grazie. Rispondo alla prima.
So I'll answer the first question.
Per le vaccinazioni in Brasile, come dicevo,
for the vaccinations in Brazil, at the moment, the situation is pretty fluid. There's a very lively debate going on within the federal parliament, so we have to wait and see how things develop and the outcomes. So that's why we have estimated both cost and time frame. The most recent news was that it should be possible for private people to big businesses to buy vaccines, but then they have the duty to give part of it to particular areas, and so the ship hospital doesn't enter into this category exactly. So it's an ongoing debate. That's why we too found alternative ways, help for vulnerable families, help for hygiene and prevention, and so on. Where to do it, we started there because we're able to do things immediately. All the infrastructure is already in place, the diocesan project. That's obviously we would be delighted to do it everywhere else, including India, as Vinu Aram said, and Africa, which much isn't being said, but it does need the vaccine. So this is according to what comes in, and therefore the countries need to open up with greater people, and organizations need to put greater pressure on governments, which to do far more than they would think they would be able to. A lot of NGOs are not able to do stuff because of financial and problems and controls, whereas other people and organizations are able to do more. I think this symbolic action will already stimulate and encourage governments, its people, with a number of organizations, cultures, and religions and nationalities. This is already a stimulus to governments. We want to take care. We want to care. There must be a political response here. It was said, and I agree, we can't think of profits in the face of a pandemic and a global common good. The appeal that was launched by Professor Yunus in 2020 to reach every country in the world. This is the vaccine is a global common good. It's the answer for today, Therefore, there's a popular grassroots action and there's a political action. So the summit of the G20 on health, there are key figures there from different states who can have influence, perhaps on the world of commerce and business. So it's in these days the suspension of patents or an agreed type of a patent which includes social responsibility for the producers of vaccines, pharmaceutical companies, and then people sharing know-how, the supply lines, and so on, to the whole cooling or not cooling systems. So to spread the real possibilities around the world, this requires policies and politics that call for our contribution. The Italian government is there. We called for a meeting so that already from tomorrow and in future weeks there can be concrete, genuine action that's really needed.
Grazie. Apriamo la possibilità ad altri giornalisti per fare
Thank you.
domande.
Other journalists?
Hello, I'll speak in English. I'm calling from Washington, D.C., and I'm assistant editor for Living City magazine. Just to give quick understanding, for the U.S., with 32 million COVID cases confirmed and 580,000 deaths, it's interesting to note that only 37% have been fully vaccinated, even with all the availability of the COVID. So we're looking at a question also of misinformation. My question, therefore, is what are additional, this press conference is very important to even open wider the conversation about the need for vaccine, not only within our country where it's available, but also so much more direly needed in other countries. What are the other communication tools that we have to spread this information is one question. And the second question is, what are the channels to transfer those much needed tools? We know of certain companies here in the US who are producing perhaps the respirators for third world countries, and how could those types of technologies be shared? I'm looking at especially also to India. Thank you.
Can I take that question? Yeah. So let me break the questions into three parts. The first part of your question is about misinformation. And in fact, all of us who have been part of large COVID response efforts have spoken about this infodemic, wrong information that is being spread. There is only one way to do it, and that is good science being communicated by good people. Now, there's a difference when I say good science is good science, the evidence that comes out of organizations like WHO, that comes from national scientific organizations. But good people is an important part of that communication. People who are respected, people who are trusted, people, and that is why I think the voice of Pope Francis, the collective voice of the Focolare movement, is so important. Good science and good communication. Also, we are all people, many of us are people of faith, and we must not give up. This is not the time to give up. The same message over and over again. For 15 months, many of us have said, nothing has changed in prevention. The mask, the physical distancing, and the hand washing. What has been added is the vaccine. So I think patience, perseverance, good science, and good people have to be there. And we have to, if I may say, we might have to create a pandemic of the right information going around. Many people are doing it. We should join hands to augment this voice. The second question that you speak about is vaccine coverage. And this is very, very important because I see the global statistics, and you speak about 1/4 coverage in America where the vaccine is available. But if you look at the total graph, you will see just like there is an unequal world and the distribution of wealth is unequal, vaccine coverage is also been very unequal. So I think, again, the voice for solidarity and right information and calling leaders, the power of persuasion, keep telling leaders, all of us, vaccine for all, vaccine for all. We have to keep the acceleration going on this messaging, because once we have presented to us this call, if you take the English word responsibility, if the response is vaccine for all, then the abilities can be found. How do we produce enough vaccines? IPR waiver, IPR cooling, technology transfer, multiple vaccine production units through COVAX. That's one. Supply chain. Second, remember, you need human beings. I was very, very touched by the intervention of our nurse from Brazil when he said, and Stefano said about volunteering. Remember, the vaccines need human volunteers to vaccinate. I have been standing every week to look at the vaccination in my country in India. To vaccinate 1,000 people, that's a lot of effort. So we need human resources and aggregation of human resources. There's a great possibility for volunteering. And faith communities, non-governmental organizations, there's a great time to step up and join. Part of the ability, again, I think, is the healthcare infrastructure. The healthcare infrastructure in countries, including India, is very thin and limited. So we will need a lot of creativity. And the project in Brazil, for example, boat that is carrying, have to be creative. So the first part is about misinformation and how good people and good science and perseverance and patience. The second is about the commitment to vaccine for all, and then building the responsibilities. In India, we started, we have a little lull now, but we are keeping on speaking about vaccine for all in individual states, and we should not stop speaking so that the supply chains are moving. And like Stefano said, this whole pandemic has been about people to keep that openness in our mind. Stefano used the word fluidity. I will say openness. As people of faith, not only do we know reciprocal love, we know that God's grace comes and we can be open to uncertainty. But the mission is one, that we will use the best tool that science has given us, vaccine for all, at the moment, along with the social vaccine to go on. So this is a long answer, but I hope it answers your question. We are in together, and we must remember our abilities will grow if our response is around vaccine for all.
Thank you very much, Vinu Aram, for this answer.
Thank you, Vinu Aram, for your answer.
Nel nostro set principale possono rispondere a quell'altra domanda che
Perhaps our speakers could also address the question of channels of communication that can be used.
Adesso abbiamo creato un Instagram con il nome della nostra campagna.
We've created an Instagram channel. We have a website which enables you to donate. We have a Twitter feed, a Twitter account, or whether these are our main channels at the moment. There are other organizations that can become partners. And so the wider the network that we have in the world, it can spread not only the popular action among the people, but also in politics. So there's over 40 organizations engaged in this, who have adhered to the campaign. They come from different countries in Italy, Spain, Mexico, Argentina, and others. So any further questions? If there aren't any more questions from Zoom, there are some that have come via YouTube. One says, we know there are initiatives at the level of European institutions to make it possible for are we aware of opportunities in the institutions at European level to make the vaccine available to all? Yes, there are many. We hope that tomorrow a stand will be taken and the European Union will be very clear about this. This is an action that has to be done by networks connecting with networks throughout the world, creating yet another opportunity not to forget the power of united action and to have the right pressure on governments, working together with many, many other people for the vaccine for all.
Un'altra domanda che ci arriva attraverso la chat YouTube è
another question via YouTube is that when will the fundraising begin? I can answer this. It's already open. It can start now. So if you look at the website of vaccineforall.org, there's a button there where there's all the information you need to make a donation.
Non so se abbiamo qualche altra domanda.
I don't know if there are any other questions.
Ecco il sito, lo trovate adesso.
So here we have the website.
Lo trovate su vaccineforall.org. La possibilità di donare. Sopra a destra c'è il bottone.
So up on the right-hand side, there's the button donor, which presumably on the English translation is give or donate. And on our social networks, as Clarinia said, these two are means to promote and spread the campaign. Instagram and Twitter.
Can I add one point?
Sure. Yes.
I think I want to also give a practical experience from India. We started our vaccination drive in January. While there was a lot of vaccine hesitancy in the beginning, but it has been picking up, and we are very grateful to the elders in India, our older fathers and mothers and elders who gave traction. What I wanted to say is a piece of evidence from India. In the second wave that we are now in the midst of, and many people are affected, all the people who are vaccinated seem to be protected more. So the vaccines are working. One more reason why you must support this cause, not just for justice and equality, but because it works practically in the protection. So people who are vaccinated have found to be less at risk to go to hospitals or to go to intensive care. And we are doing what we call death audit, people who have died. And we have found that most of the people who have lost their lives is because that they were not vaccinated. So they were exposed to it. So please continue to give to this wonderful cause. It works, it protects people even as the pandemic goes on.
Thank you very much for this contribution.
So we've reached the very final moments of this press conference. Thank you for being with us. And we remind you of the official website of vaccineforall.org. You can also contact us via email, the address info@vaccineforall.org. Thank you again and goodbye.
Grazie. Thank you, everybody. Thank you.